Health experts have convened in Kano to tackle the issue of poor immunization across Nigeria's northwest region. Trust TV correspondent Idris Jibrin reports that the vaccine hesitancy and inadequate immunization efforts have over the years resulted in the untimely deaths of thousands of people throughout the region. His report.
For the last century, vaccination has been the key to preventing childhood illnesses and improving the lives of society. But Nigeria has been left behind in terms of vaccine acceptance and coverage, a challenge that requires urgent attention for improvement, especially in the northwest geopolitical zone of the country.
Our best period was in the late 80s and early 90s when Professor Olukoya Ransom Kuti was the Minister of Health. That was when the country attained nearly 80% vaccine coverage of all children eligible for vaccines, and almost 100% for BCG at that time. Unfortunately, we have been sliding backwards and backwards to the extent that now we have just about 30% coverage across the country.
These health experts and their social media influencers were brought together across the Nigeria's northwest region to brainstorm on the problem of immunization in such a way as to improve the health condition of mostly women and children across the region.
In the southwest, I think they have the highest, almost 70–80%. But in the northwest here, our zone, the coverage is just about 25% in terms of childhood immunizations, the 5 key immunizations that you have.
According to these experts, the problem of infrastructures resulting to difficulties in accessing healthcare services among mostly the rural population of Nigeria, government negligence and poor awareness are largely responsible for vaccine hesitancy across northern Nigeria.
Immunization saves life. Nigeria has a program to vaccinate children for the common childhood killer diseases. This is tetanus, diphtheria, tuberculosis, pertussis, polio, and rotavirus. And now Nigeria is introducing vaccination against human papilloma virus. This human papilloma virus is a virus that causes cancer, especially in women, cervical cancer.
The Regional Immunization Champions Workshop is also expected to come up with a policy framework on how best to create awareness among Nigerians on the importance of immunization, especially in preventing childhood-related diseases.
The goal of this workshop is to enable and to increase the capacity of healthcare workers that were invited, that is the participants and the influencers, to have enough knowledge and skills to go back to their community to advocate for better vaccine uptake, especially of the HPV vaccine that is coming.
At the end of this workshop, these health experts are expected to be properly informed on how to ensure improvement in immunization coverage across the Nigeria's northwest zone. Idris Jibrin, Trust TV News, Kano.